Hi dear students, today I am going to talk about identification of maladaptive behavior. So in this we will see a guidelines and steps to identify a problem behavior. We have already discussed what is problem behavior, that is called undesirable behavior. Okay, so let us see what are the guidelines to identify the maladaptive. Let us see the guidelines of maladaptive behavior. That means to identify the maladaptive behavior. So when the behavior is harmful to oneself, if the child is doing undesirable behavior, okay, let us say the child is spitting on others, that means it's not harming himself. Let us say the child is banging the head, that means it's harming himself. Okay, so that you need to check very clearly. So when the behavior is harmful to other, for example, if he has always a habit of you know throwing the objects, so whether it is harming to other or not, that you need to check. Whatever the undesirable behavior, see, undesirable behavior is what? Kicking, throwing, anger, temper tantrum, spitting, flapping the hand, okay, banging the head, some aggressiveness. So these are all undesirable behavior. But the rule of observation is this: when a behavior is harmful to other or not, whatever the child is performing, check it out whether it is harming or not. When a behavior interferes with the learning process, so if he is doing that particular behavior, whether it is interfering in his teaching, I mean to say in a learning process or teaching learning process, when the behavior is not socially accepted, if he is doing, let us say if he is spitting on the other, that is not socially accepted. So you have to observe, you need to understand the child has some problem. When the behavior is not appropriate, that you need to observe clearly. The above characters must be observed every day. Okay, if, for example, one day he is doing, another day he is not doing, that means it's not a desire, not a undesirable behavior. He we do that on, quite occasionally we do that, but that is not a undesirable. So if you want to identify, you need to observe the behavior every day, whether there is any consistency, whether there is any frequency or not. See, you know rare occurrence of this behavior cannot be termed as a problem behavior, right, as I said. So what you have to do, so what is the criteria used in this regard? You have to see the intensity, as I said. Okay, that's why you need to observe every day: intensity, frequency, duration. So IFD, that means these three important criteria you need to observe. Intensity means severity of the behavior. If it is flapping the hands, or if it is banging the head, what kind of severity is this? He is doing it's very severe. He when he bangs the head, it's like it is destroyed. Or he's spitting on other, it's very severe spitting. Whomever he sees, he spits. And frequency, the number of time of occurrence. If he's spitting, how many time he's spitting in 1 hour, in half an hour, in a day. Okay, duration of a time of the behavior, when it happens. Okay, whether someone arose him, then it happens, or someone triggers them, then it happens. So intensity, frequency, duration is very important criteria to observe the behavior. Okay, so for example, crying is a common behavior seen in children. You would have seen number of time even in your kids, or even in while teaching in the classroom, or whenever you are handling the child in the clinical setup. So crying is a common behavior seen in the children, but that is normal, and that is pretty normal. So similarly, crying very loudly with high intensity, that is your intensity. Okay, high intensity, severity, and lasting for a long duration cannot be considered as a normal. Okay, if, for example, okay, if he's crying and fine, after 10 minutes if we give something, he gets off. But if the crying intensity level goes high, and it's going on, the duration, the length is huge, that means that's cannot be considered as a normal behavior. That means you need to do some sort of behavior modification, or you need to go for the further step to find out in detail. So let us understand the steps to identify problem behavior or maladaptive behavior or undesirable behavior or targeted behavior. There are different terminologies, you can use it. Okay, all are same, there is no much difference in that. Let us see the first step, identification of problem behavior. Now here, how you're going to identify the problem? These are the identifying the maladaptive behaviors. Okay, so in this first step, identification of problem behavior is about what you're going to do here. Once the problem behavior is brought to the notice of teacher, it is his or her duty to identify appropriately by applying the guideline just now which you have seen. Okay, so the first step is to just check it out whether the child has such screening characteristics or such basic characteristics of problem behavior as per the guideline or not. That is your first step of identifying maladaptive behavior. Then second step is your behavior description of problem behavior. So behavior description is very, very important. For example, a problem behavior like anger can be viewed as abusing somebody, shouting at other, beating other, or self-beating, throwing things to the other. Hence, by using the term anger, it will not be possible to plan a management program, right? So if I say the child is angry, okay, plan your educational program or intervention. How you can prepare until unless you know the detail of the child. So it is essential that behavior is described in objective manner which could be observed and measured. So in detail, what kind of things is, why he is getting angry, when if someone says, or what is the antecedent behavior, you need to understand. So in behavior modification, symbolic term of the behavior has no value. Only behavior term are used for describing behavior. That means behavioral, he is shouting on others, that is the thing. Okay, he is throwing the object, that means this is the characteristics of angerness. Once you know, then only you can plan it out, if not you cannot. So behavior description of problem behavior is very, very important to identify. So once you have screened, once you have described your behavior, and the third one is your principle for selection of problem behavior. Now you have a series of problem behavior. How you have to select that? You need to prioritize the problem behavior. Okay, so you need to follow certain criteria to prioritize. See, choosing a problem behavior which are easy to manage, as this will help the teacher to gain the confidence in managing more difficult problem behavior later. If you select very hard maladaptive behavior initially, then sometimes your motivation level comes down if it doesn't works well. So identify the simple problem behavior initially, build the rapport with the child, and then you try to take the your intervention ahead. Second one is you're choosing a problem which are dangerous in nature, but you cannot ignore as well. So you need to choose which is very dangerous, okay, and which is which you cannot accept it. So that is very, very important. These two criteria is important to select your target or your problem behavior. So a child may pose more than one problem, okay, so but only one or two problem at a time is selected for management. That's very, very important. So in this, so this principle you need to apply so that you can train the child. You can select the problem behavior, identify the problem behavior in appropriate manner, and you can provide the intervention. Okay, so let us move to next step, that is a fourth step, which is called baseline assessment. Once you have selected the problem behavior, okay, the child is kicking the other, that might be your problem behavior. So you need to do the assessment, the level of the kicking. So observation technique you need to apply for that. Now see, there are 4 points for observation: what to observe, when to observe, how to observe, and where to observe. So this 4 point is very, very important. This 4 observation technique is very, very important to understand the baseline of maladaptive behavior, which you have selected based on the principle, based on the prioritization principle. So you need to assess, you need to identify the current level of the child, then only you will be able to plan your intervention. So this 4 step is very, very important to identify the maladaptive behavior. Now let us see a behavior. Now see observation techniques. See, as I said, the observation technique is very, very important. So we are going to discuss 4 observation techniques to observe the undesirable behavior. Okay, so this behavior can be observed by directly or by automatic recording systems. Okay, so event or frequency recording. See, in this what happens? In this event, a frequency recording, that means the number of occurrence of problem behavior is documented. Okay, if the child is kicking, that means the occurrence of problem behavior, the number, how many times. So after a direct observation for specified period of time in a given day, or you can say in a given week, or 1 or 2 days, 3 days, you need to check it out, or you need to note down, you need to repeat that for at least 3 days. 3 days of observation, even you can go for or at least 6 days, that will be giving you a clear picture. Okay, then duration recording. See, name itself indicates. Okay, frequency recording means number recording. Duration recording, see, this tool used to record a behavior which varies in the length of occurrence. Okay, for example, not paying attention in the class, staring outside, overactive behavior, then rocking behavior, etc. So what is the length? If you make the child sit at the window, he will be watching outside for 1 hour, for 2 hours. That is your duration. Okay, so recording the behavior is obtained by documenting the duration of occurrence of that particular behavior for specified period of time in a given day. Again, you need to repeat this for minimum 3 days they have mentioned, but as I said, you can observe for 6 days for getting a clear picture. Okay, now next one is your interval recording. See, occurrence of problem behavior is observed in short span of interval, like observing the behavior in every 1 hour of 5 minutes. It can be used for a recording both frequency and duration. See, it's very clear. Interval, that means in 1 hour you're going to observe every, as it is mentioned, for 5 minutes. So however, if the problem behavior occurs in between, the recording will be done only during the interval chosen for the same. Let us say here they have given 5 minutes, which I will take 10 minutes, I may take a 15 minutes. So every 15 minutes I will observe the child if he is doing that undesirable behavior or problem behavior or not, and then I will record. Okay, and then time sampling. Here the problem behavior is recorded only at the predetermined time, whatever you have determined, selected. For example, observing the behavior of the child at every 30 minutes of interval. This method is used when the frequency of the duration of undesirable behavior is very severe or more. It does not require a continuous observation. For example, in interval, what you will do in 1 hour every 5 minutes, that is the interval time, but here it is fixed every 1 hour, every 30 minutes, every 20 minutes. But in time sampling method is only applicable when it is very severe, when the behavior is very severe, when problematic or not controllable, then only you need to do the time sampling. Okay, so anyways, this is the techniques of observation to identify the maladaptive behavior. There are a lot of other, but I have make it very short to make you understand. So hope you have understood how to identify the maladaptive behavior, or something you have understood about maladaptive, how to identify it. So in next class I will be talking about the behavior modification technique, and then we will see how to plan the behavior modification plan. So I think you have understood in this. Till then, bye bye.